forcing people to get something for their health, right? I mean, you cannot let somebody die because they don't want to.
There's also a question of accountability, which is, okay, it's all nice to sort of encourage this, but what happens if a certain department or certain hospital isn't delivering effective interactions? And I mean, the tools are now there to be able to deliver that and are being done. Patient experience measures are kind of increasingly common practice, so that if you can use those to drive up standards of however you want to describe engagement, good engagement, and that can be shared and delivered and actually penetrate the consciousness of the patients rather than just the illuminated ones. Then but I think that will change, and certainly it's changing.
Well, that was our attempt. Thank you very much, Jim. Which just leaves group 3, so the floor is yours.
It's me again. No, I have to translate what I draw.
Need more papers.
More colours.
Yes, more colours.
More colours. Everybody help me out. I'm just going to go on the top, I think. We started to try and wonder what participatory medicine means for the two groups. Firstly, healthcare professional. Secondly, the patient, the ill person. And there's a suggestion that healthcare professionals, some were up for it. There was is it about age? Is it, young healthcare professionals are more into this stuff, grew up with it? Differences across geographies, countries. If there's something around, what do healthcare professionals want in this environment? What do they want patients to do? What do they want from them? And then we had a long discussion around is it a closed network? Because from a patient point of view, we know they go through a journey where they know there's something wrong with them. The healthcare professional, they go and see them, they recognise it, they diagnose it, then they go home. And they might go home with a bit of paper, some advice. They might go and see somebody to get medicine or whatever treatment they need. And they're not quite sure what to do next. But similar to the second group, sort of start words around the importance of family and all of the other stakeholders in this support network. A few of those listed there, they were going to become important if the everybody working together will help this patient get better. So then we came back and said, well, okay, what does that mean for the healthcare professional? How do we encourage them? And how do we encourage healthcare professionals? This is a good thing. There may be information that's good or bad coming from any of the other people in the network. So how do you encourage them that it's going to work? And that was around sort of trying to describe or demonstrate the benefits that this whole system could bring. So could you start with easier networks? So are more healthcare professionals being professionals on something like LinkedIn, professional networks, than they are perhaps on Twitter, this constant stream of stuff? And does that help in gaining confidence? What's the value of the network they support? Is there a financial value? Ultimately, is the outcome a better off patient? Is it going to save them time? Is it going to make the care financially viable, perhaps? We didn't know. Then it's where are we at the moment? So have we got any examples of where it's working? Can we actually find these benefits anywhere? And there's a bit of discussion around particular examples. Then we came back to, healthcare professionals are constrained by time, recognised earlier. Are there things that we can, or that could be given to healthcare professionals that are going to help them with diagnosis, things that they can send the patient to that helps them with that time issue, provide the ongoing support, and therefore help solve that time puzzle. So we came back to what are the benefits. And then I ran out of space, so I went to page two of 3. And sort of said, well, hang on, it's all right, well and good, but is there a link between smiley doctor and ill patient? Is there a social media link? And again, I think this demonstrates some of the things that was mentioned in that the healthcare professional, the consultation, does a closed environment, a personal environment feels more what they may want and what they may perceive they need in order to have the intimate conversation that they may well have with the patient. And actually, does the patient want to have an intimate conversation in a massive social network, or do they want to have that one-to-one time? And then there are two sort of strands going down here. I think the interesting thing is that it wasn't very often that they crossed. So I think we got ourselves caught up in a sort of, what's the nature for the healthcare professional? What's the nature of the consultation? The more information you get about a patient, the more time you need to read it. We all know that if you read every healthcare social media stream, then you probably don't do anything else in your life, because there's so much of it. But it could help make better decisions. But again, it's back to the old time, and actually the more information you get means you may need a deeper consultation, which is it's not a virtuous circle. Meanwhile, down the patient side, about this intimate conversation, are they trusting? Is a patient trusting enough that they can go online and talk about this? And if they're sharing information about themselves, i.e. Google Health, then who's looking at it? The privacy concerns, etc., exist. Then we did have a recognition that a community of patients is something that can offer the support that we talked about earlier, but again, it's not necessarily linked with the healthcare professional. So, as I say, as I was scribbling, I felt like I was doing two things as opposed to actually finding the social media link. Then Andrew Spong came up and started hassling us and telling us it was taking too long and all that kind of thing. So we ignored him. We started page 3 and started to go back to the question and say, which said something about fragmentation of the HCP voice, and we sort of started to inquire about that. And is there a problem here, or what are we after? And then really it started to get very sort of ethereal and. Why is it fragmented? Because some healthcare professionals are in there, some aren't. I think there's a desire in the question, or we recognise the desire that we want to get more healthcare professionals in this space. We recognise that time is an issue. We're back to the first sheet of how do we encourage those who traditionally wouldn't use it. And then we started talking about KOLs. Pharma companies talk about KOLs. Could there be doctors that become voices in among patients, and we recognise again fears that a doctor goes to a party and starts talking about what they do for a living, and immediately people start saying, "Oh yeah, I've got a bit of a problem," and that's not kind of comfortable. And then we're talking about media, and you have doctors on TV, and actually, do they need to be doctors, or do they just need to be somebody offering advice? And could a celebrity do it, or a famous sports person say keep fit? So there's a bit of debate around that. And Andrew Spong was outside and he was telling the governor. And so we sort of got to a point of saying, well, if we are looking for something at the centre of this whole relationship, is it just good information? And is it, whoever gets the information, if they're prepared to discuss it, is that the place to start? And with that sort of, frankly, fragmented bunch of information is where we really got to. I don't know, Rob, or any others.
Good mornings.
Very good. Got their head around it any better than I did.
In my view, it is as I look through my eyebrows, what the three groups have done, is deliver question stating actually that we don't know how to approach the system, how to get things done. This is talking about innovation in a very regulated world and a very structured world. And it will be very difficult to change fundamentally things that will yield, participatory medicine yields better patient-physician interaction. It's a huge job that we are confronted with. And I was thinking that our group had the most question marks, and I was thinking we are not working as a good group, but the other groups came to the same point or point. So it reinforces the conclusion that it is very going to be difficult.
Well, we made a lot of assumptions about healthcare professionals. So if there's a healthcare professionals in the room,
one
please.
of the major problems I have with a lot of this is language. It's
Yeah.
a real turn off for healthcare professionals. You know, I don't actually understand what KYOHealth is.
Key opinion leader.
Yeah. So
Yeah.
you instantly
Yeah.
switch off positions, and we need to get through that barrier if we want to get people online. I mean, I was explaining to a couple of people actually today. My consultant was my boss. Saw that I was tweeting. So, what is this? You know, are you just telling me what you're eating for breakfast? Is the classic thing to get told. But it's that. But engaging him. So I had a particular patient who was unwell, and so he said, "Okay, show me what this can do.
Yeah.
Tell me if you can get some information from your Twitter community that will help me with managing this patient." So I put a question online, and I got a feedback from in fact, he's a computer scientist, not even a healthcare professional, about a particular condition that this patient had. And so that experience with him, that positive experience, was something that we can see as a direct correlation, is the way that I've engaged with healthcare professionals and how this is being. So the first question you always get, first statement is always, "Oh, isn't that just for saying what you have for breakfast?"
But if I got a breakfast menu from you as a healthcare professional, then that to me would be certified health information that I would probably go off and eat the same things tomorrow morning.
And for me, it's not. It's about understanding what your role is, just knowing how you're perceived, and knowing, and so, you know, I'm quite happy to use different media. That's because I understand what I'm saying is public, and what I'm saying is, you know, and that's the same way as if I spoke at a conference or if I wrote a letter to the editor of a newspaper. It's not new. It's just you need to have that thought before you write. This is a blog. This is your and so whatever you do, you have to have that in the back of your mind.
It goes to know your audience, right? So know what you're saying and who's going to see it and what it can be used for. You know, I had a question for you. You know, you drew the healthcare professional as the happy person and then the patient as the sick person.
Yeah.
But there's also the healthy pre-patient, right? So there's also the dialogue with the patient before they get sick or after they're better. So there's so many different, you know, so you have the person who could become diabetic, but perhaps you can stop them from getting there. So there's so many different time points in that relationship. We think of it that way, and that's sort of the main way. But I think of it as, you know, who you're talking to, how are you talking to, when are you talking, you know, why are you talking to them? So you have so many opportunities to make that relationship so much better and stronger.
Healthcare professionals were really against telephone consultations the way it started. So, well, how can I do it? I don't see the patient in front of me. And it's just, you know, that cultural change that is now, you know, made it an integral part for every general practitioner. I use it for my patients with colitis, so they go through to the medical secretary with a message, and then I follow it up. You know, it's not. It's just it's an evolution that's happening. It's building momentum. Just needs a little bit.
Do you consult online?
I don't consult online. That's one thing because I'm happy to do it when I understand the medium. I haven't quite understood the etiquette yet in order to be confident to do that. But it's not something that I would ever say.
You dismiss now.
Absolutely. I'm open-minded to it. I think there are a lot of physicians that are. It's just I need to feel confident that I understand its advantages and its limitations. So that's important.